Good afternoon and welcome. This webinar is a collaboration between the U.S. Department of Veteran Affairs, VA Center for Faith-Based and Neighborhood Partnerships, CFBNP, and the Veterans Health Administration Office of Patient Care Service. My name is True Lester Pauling. I am the Senior Outreach Program Specialist in CFBNP. I will be your moderator this afternoon. Everyone's phone has been muted. If you have a question during the presentation today, please type it in the Q&A box to the right of your screen. I will read the questions at the end of the presentation, and the presenter will provide a response. This presentation will be made available after this webinar. This is a live recording. I would like to thank Ms. Dana Brunson for this collaboration. We are grateful for your time today. But before we get started, I would like to introduce Mr. Conrad Washington. Mr. Washington serves as the director for the VA Center for Faith-Based and Neighborhood Partnership. He is a retired combat veteran with 20 years of active duty service. He is a licensed minister actively serving in his faith. He received his Master's of Divinity in Pastoral Studies from Moody Theological Seminary, Master's in Business Management, and a Bachelor's of Science degree in Education. Additionally, he is a graduate of VA's class of 2017 Virtual Aspiring Leaders Program. Mr. Washington?
Thank you, True. I appreciate it. And thank you all for joining us today. And I want to take a special thanks for Dana Brunson for taking time out of her schedule to share information about a very important program that's worldwide. So we appreciate you, Dana, and I know you're going to have some great information for the attendees today. And I also want to share information regarding another group of folks who are receiving some backlash, and that's anti-Semitism across this nation is growing and is threatening the safety and security of Jewish people. This hate has surfaced so much that President Biden has established a working group to counter anti-Semitism and other forms of discrimination and bias. This hate is being exposed by extremist groups and individuals from online and in person. You know, we must be able to bring people together from all backgrounds, all faith, and all ethnicities in order to serve our veterans, their families, caregivers, and beneficiaries. You know, that is why we have these type of webinars each month, which is approximately 3, so that we can bring people together and share information regarding the VA services and information. So I'm glad you're all here, and I believe that you're going to be benefited from the information today. So thank you for joining us.
Thank you, Mr. Washington. At this time, I would like to introduce Ms. Dana Brunson, who will be providing today's presentation. Please read a summary of her bio to the left of the screen. Ms. Brunson has served in VA healthcare for nearly 20 years as a clinical social worker, specializing in military to VA transition and care management for post 9/11 combat veterans at the Alexandria, Louisiana healthcare system. In 2016, she accepted an appointment as her medical facility's first lesbian, gay, bisexual, transgender, and queer LGBTQ+ veteran care coordinator. In 2020, she joined VA's LGBTQ+ health program as the National LGBTQ+ VCC program manager. Ms. Brunson works directly with more than 216 LGBTQ+ veteran care coordinators and 20 Veterans Integrated Service Network leads at VA medical facilities across the nation, implementing LGBTQ+ health program policies and best clinical practices to create a welcoming and affirming environment for LGBTQ+ veterans. She has a master's degree from the Louisiana State University School of Social Work in Baton Rouge, Louisiana. At this time, I give you Ms. Dana Brunson for today's presentation. Ms. Brunson?
Thank you so much, Ms. Pauling and Mr. Washington, for that warm welcome. I am really happy to be here with you all today and appreciate the invitation to come and speak about LGBTQ+ health in VA. And so I will go ahead and stop my video and begin our presentation today. I'll be starting us off with some basic background information to get everyone on the same page with the vocabulary that I'll be using throughout the presentation today. We all may be coming to this talk today with different levels of knowledge about this particular topic. Let's begin with the definition of LGBTQ+. The acronym stands for lesbian, gay, bisexual, transgender, and queer identities. The plus sign captures identities that are beyond LGBTQ. For example, two-spirit or pansexual or asexual and non-binary identity. We know that language is dynamic and constantly changing, so the plus sign also represents future terminology used within the community and is inclusive of people who are questioning of their sexual orientation or gender identity. LGBTQ+ represents a very diverse group of people with minoritized sexual and gender identities who share similar experiences of social stigma, victimization, and discrimination. In a recent Gallup poll, 7.2% of American adults identify as LGBTQ+. We're talking about 24 million people, and that percentage is rising annually, mostly among younger people, with bisexuality as being the most common identity, and especially among women. It's impossible for us to know the true prevalence of LGBTQ+ people in the United States because this information about sexual orientation and gender identity are not collected in the US Census. I am often asked how many LGBTQ+ veterans there are. VA has only recently begun to ask veterans to record their gender identity and their sexual information in their health record. And we do this because it's information that's relevant to their health care. Currently, we have about 1/3 of veterans in VA who have reported information about their gender identity. And additionally, of the number, 57,000 have reported themselves as lesbian, gay, bisexual, or queer, and 23,000 are categorized as trans or gender diverse. And these numbers are going to continue to grow as more veterans continue to report this information. And so let's take a look at some of the vocabulary that I was talking about. First of all, it's really important to note everyone has every single aspect of this identity that we're about to discuss. Sexual orientation and gender identity are important to healthcare because everyone has these characteristics. And like any human trait, they vary from person to person. There's a lot of variability. So I want to skip the first category and take a look at birth sex. And you might also hear this referred to as sex assigned at birth. Sex assigned at birth or birth sex is exactly what it sounds like. It's the recording of the sex at the time of birth, usually male or female, and often just based on the doctor's perceptions of an infant's external genitalia. It rarely takes into account the full spectrum and complexity of what really constitutes sex, such as internal reproductive organs, chromosomes, and hormones. All of these things combine to define people as male, female, or intersex. And often the label ends up being consistent with how an individual feels about their gender as they grow and begin to understand the traits and characteristics that society ascribes to sexes. And that's what gender identity is. It is someone's internal sense of self as a man or woman or transgender or non-binary person. When gender identity and sex assigned at birth are aligned, we refer to that as a cisgender person. Cis meaning same. Transgender is a term that means there's some degree of inconsistency between the sex assigned at birth and that individual's internal sense of self or gender identity. Another related term you might hear is gender expression. This refers to the speech and mannerisms and gestures and style of hair and clothes name and pronouns, all the things that we use to manifest and communicate something about our gender externally to others. It's important to note here that gender expression is not always consistent with a person's gender identity. For example, an individual who identifies as a woman but does not express their feminine gender identity due to perhaps related concerns about safety would be an example. We cannot assume what a person's gender identity is based on how they look alone. One clue that we can use to indicate gender identity is through the use of pronouns, which are the words that we use to refer to someone without using their name. This includes the more traditional pronouns like he, him, and his, she and her, they and them, or what we call neo-pronouns or new pronouns, such as ze, zir, and zirs. Some people would just prefer that you use their name instead of assuming any gender at all when you're referring to them. And the final term listed here is preferred name. Quite simply, it's the name that a person goes by. There are many reasons that people use a name other than their legal name. Many names have a gender associated with them, and so someone might choose a different name to better align with their gender identity. Other people simply prefer a middle name or a nickname. We should always respect people by using the words that they use to describe themselves. We've covered a number of different terms related to gender identity, and now I'd like to discuss sexual orientation identity. Everyone also has a sexual orientation, and this is a separate identity characteristic from gender identity. Sometimes you might hear the two concepts sort of lumped together in, an acronym like LGBTQ+. One way to think about the distinction between the two is that gender identity is who a person is, and sexual orientation is who a person loves or is attracted to. Sexual orientation refers to the emotional and sexual attraction to others, and often people have a label that they use to describe this, such as straight, gay, lesbian, bisexual, queer, asexual. There are many different terms related to sexual orientation due to great variability. And it's important to folks because this is the way that we all relate to each other. Relationships are a huge part of our lives. We are meant to connect with others. And because that human connection is so highly valued, people spend a lot of time and effort figuring out how to describe the ways that they relate to others. And that's part of the reason that why the language is continuously changing and evolving. In healthcare, clinicians should inquire about a person's sexual behavior and sexual activities and practices. These practices might not necessarily match up to the person's sexual orientation, and that's why it's important in healthcare to ask about these characteristics. For example, assessing a man who identifies as straight but sometimes has sexual activity with other men is important to know for providers when we're making recommendations for screening and preventative care. So hopefully we've got a little bit of common vocabulary now. Our take-home points related to these terms are that sexual orientation and gender identity are not the same thing. They are distinctly different aspects of being a person that all of us possess. Sexual orientation and gender are social determinants of health, which are non-medical factors that influence health outcomes, much like age, race, ethnicity, education, economic stability, access to healthcare, environment, and social support. And health disparities are the preventable differences in disease, injury, violence, or opportunity to achieve optimal health that are experienced by minoritized populations. In healthcare, it's critical to access sexual orientation and gender identity as part of that comprehensive care because we know that people who are included in minority groups often experience poorer health outcomes. Now I'd like to take a minute to look at the unique historical context of LGBTQ plus veterans because LGBTQ plus folks have experienced stigma and discrimination in our culture and in our society for more than 150 years. The Department of Defense, as a societal institution, has participated in stigmatizing and discriminating against LGBTQ plus service members. It's important to know how this history happened because veterans carry it with them. It influences how they think about their health care, how they think about healthcare providers, and getting care, or even working with federal agencies and partners. The Department of Defense began banning lesbian, gay, and bisexual service in 1942. Don't Ask, Don't Tell was the last in a series of bans on service for lesbian, gay, bisexual people. Don't Ask, Don't Tell was promoted as a more compassionate policy. And as part of the policy, the Department of Defense agreed not to ask people about their sexual orientation. It also required service members to serve in secret and lie about who they were, because if they said they were lesbian, gay, or bisexual, they would be kicked out. The other part of the policy that often gets lost is the Don't Harass, Don't Pursue directive. But in fact, the Department of Defense did ask service members about their sexual orientation and did harass and pursue them. And as a result, at least 14,000 service members were discharged during Don't Ask, Don't Tell. The formal bans on transgender service have a less lengthy history, but a history nonetheless, and transgender people have been excluded from military service for a long time. That ban ended briefly in June of 2015 when the Department of Defense changed their policy allowing transgender service members who were serving in secret to be open about their gender identity, and they were allowed to receive transgender-related care in the military. The next administration announced plans to re-implement the ban on transgender service. That announcement was met with quite a few court cases. So that policy was put on hold until 2019. And then from 2019 to 2021, the new policy required enlistees to serve under the performance standards for their original birth sex. The policy was again reversed in 2021, and the Department of Defense now allows service members who are transgender to enlist and be open about their gender identity and receive transgender-related health care. Due to this history of discrimination in DoD, there is a misconception of VA as a civilian extension of DoD, and veterans often expect discrimination and uninformed staff in VA. So what does this mean for LGBTQ plus veterans? For LGBTQ plus veterans experiencing this type of ongoing discrimination, the next thing that I would ask myself as a provider is how does this potentially impact their physical and mental health? Minority stress theory describes that typically people experiencing minority stress experience high levels of stress, and that may be causing certain factors to include caused by certain factors to include social support and low socioeconomic status. And well understood causes of minority stress are interpersonal prejudice and discrimination. There have been numeric scientific studies that show when minority individuals experience high degrees of prejudice, this causes a stress response, such as high blood pressure and anxiety, that accrue over time and then lead to poor mental and physical health. Minority stress theory summarizes these studies to explain how social situations lead to chronic stress and poor health among minority individuals. It's been shown to directly impact health factors such as immune system response, levels of inflammation through the body, cardiovascular function, stress hormone levels, and things that really impact a person's well-being. The important thing to know about this is the experience of stigma and discrimination in society directed toward plus people and the anticipation of future discrimination results in veterans having higher rates of some mental and physical health conditions compared to non-LGBTQ plus veterans. What we see is that LGBTQ plus veterans have a higher prevalence of trauma. That includes military sexual trauma for lesbian and bisexual women and transgender veterans, and higher rates of diagnoses of PTSD, substance abuse, higher rates of housing instability, and generally poor mental and physical health outcomes that include extremely high rates of suicidal ideation. LGBTQ plus veterans are 2 to 3 more times more likely to engage in suicidal behavior, and transgender veterans are up to 20 times more likely to engage in suicidal behavior. And the fact that VA healthcare users are more ethnically diverse and have more health conditions than non-VA users adds an additional layer to the risk of vulnerability in this population that's seeking care in VA. That's why it's so important that we assess sexual orientation and gender identity. We can't provide comprehensive patient-centered care if we don't properly assess the identity risk factors in the care. There are unique health considerations for LGBTQ plus folks, and we can't just take a one-size-fits-all approach. Perhaps the more important question to ask ourselves is, why do these disparities exist? And what is unique about the intersection of LGBTQ plus and veteran identities? And how does that impact the care that we deliver? We want to make sure that LGBTQ plus veterans are receiving appropriate and affirming care that they deserve, and that they know that they are welcome and expected at VA. I mentioned earlier that our program is frequently asked about how many LGBTQ plus veterans there are in the United States. And we don't know the answer yet because the information has not been historically collected in the US Census. But we do have data from other large national representative surveys, and they estimate that there are likely 1 million US veterans who identify as LGBTQ plus. We do know that the majority of veterans don't actually receive their care through primary care in VA, so the numbers are probably smaller within VHA. Historically, VA has not collected this data to understand how many LGBTQ plus veterans are receiving health care and benefits with us. But in the last several years, LGBTQ plus health program has developed ways to do this. Veterans can now self-enter their gender identity on va.gov, and that data is then transferred into the medical record in CPRS. So far, about 0.5% of the entries reflect a transgender or gender diverse identity. And for collection of sexual orientation, there's a new national mandatory clinical reminder in the electronic health record that was rolled out last October. Since October, we have gathered sexual orientation data on about 1/3 of veterans who are using VA healthcare. And currently, a little over 2% of those entries reflect an LGBTQ plus identity. We're beginning to get a better sense of how big our population is, but it's going to take some time before we know, before those fields are fully populated and we really understand how many LGBTQ plus veterans there are. So what is VA doing for LGBTQ plus veterans? We have 4 strategic approaches to addressing LGBTQ plus health disparities. We are promoting inclusive assessment of sexual orientation and sexual health by providers and educating veterans about the importance of adding their preferred name and gender identity to their medical records. VA has also begun to include the option for veterans to provide their sexual orientation and gender identity information in our patient satisfaction surveys, such as V-Signals and SHEP. VA is working toward continuous improvement of national healthcare policies. In addition to the 2 policies that are managed by the LGBTQ plus health program, we also have policies that explicitly state that for veterans who are patients or residents in our community living centers, VA does not discriminate based on sexual orientation, gender identity, or gender expression. We also work with other programs and services in VA to ensure that their policies are affirming and inclusive. Our third strategy is to provide education to VA providers and staff through our online education programs, virtually and in person, through our LGBTQ+ health coordinators. We also provide clinical support resources on our internal SharePoint database for VA employees. Some of these resources are also available to our community partners. And we try to inform and engage LGBTQ+ veterans through outreach and through visibility. Some examples would be attending community outreach events, posting welcoming signage, and communicating about our program and resources through the LGBTQ+ page on VA's Patient Care Services website. And so that is the bigger picture of what VHA is doing to promote the health and well-being of LGBTQ+ veterans. More specifically, the LGBTQ+ health program was established in 2012, immediately following the repeal of Don't Ask, Don't Tell, because VA wanted LGBTQ+ veterans to know that VA has their own policies that outline personalized patient-centered care to meet the unique health needs of LGBTQ+ veterans. And we want veterans to know that they're expected and welcomed at VA. Our program's mission is to facilitate policies, establish metrics, and develop clinical education to support this goal. Our vision is to create a VA that all LGBTQ+ veterans will choose to receive affirming care and achieve optimal health outcomes. LGBTQ+ health program manages 2 directives or policies on healthcare for veterans, a transgender and gender diverse provider to provider e-consult service, a gender affirming program for speech. We also oversee the LGBTQ+ Veteran Care Coordinator program and produce educational material and resources for VA and for the community. And here you can just see a little bit more information about something that we've previously discussed, ways that we're promoting an inclusive assessment to include sexual orientation and gender. And this is an updated look at the data fields on data collection. So right now in the data fields in CPRS, we know that more than 300,000 veterans have included a preferred name that they would like used by their healthcare providers. More than 2 million veterans have included their gender identity in their medical record, and more than 3.5 million veterans have included their sexual orientation identity in their medical record. Gender identity and preferred name fields are included in VA's application for health benefits and can also be entered and edited online at va.gov. And here on the right side of this slide, you see a Do Ask, Do Tell poster, which is part of our media campaign that encourages veterans to come out to their providers as an important step in their health care. And now I want to talk to you about the 2 policies that LGBTQ+ health program manages. The first one, and I'd like to mention again that VA has its own policies, and there has never been a Don't Ask, Don't Tell in VHA. So VHA Directive 1340, the provision of health care for veterans who identify as lesbian, gay, bisexual, or queer. This policy states that all staff members, not just clinical staff, all staff will provide appropriate veteran-centered care with respect and dignity to LGBTQ+ veterans. Perhaps the most important piece of this is that VA clearly prohibits any attempts to convert or change a veteran's sexual orientation. When we say that, we mean even informal conversations that might suggest someone's sexual orientation is not okay or it's unhealthy. It is expressly prohibited by VA. The reason it's prohibited is that there's a great deal of research that shows that this kind of communication is detrimental to people's health. And we're a healthcare organization, so we don't want anyone engaging in activities with veterans that might hurt them while they're at a VA facility. We also expect that every veteran will have an annual sexual health assessment. This is not exclusive to LGBTQ+ veterans. Sexual health is an important part of health for everyone. Everyone has sexual orientation, everyone has gender identity. Many veterans have active sexual lives, and it's an important part of their overall health and quality of life and quality of relationship. So this policy recommends annual sexual health assessments and important follow-up. And just because a veteran doesn't mention sexual orientation or sexual behavior, it doesn't mean that they don't think it's important. Some veterans won't raise these issues because they worry about being judged or discriminated against based on their responses. This is particularly true for service members who serve during Don't Ask, Don't Tell. Although the topic can be uncomfortable and embarrassing for some veterans, VA health providers should take the responsibility to ask about this important health-related issue. Research shows that most people expect and want their healthcare providers to ask about sexual health. Asking these questions gets easier with practice, and it contributes to shared decision making. The next policy that I wanted to tell you about is the Transgender and Intersex Care Policy, and this is VAJ Directive 1341-3. VA provides clinically appropriate veteran-centered care with respect and dignity to all veterans, and that care will be delivered based on their self-identified gender identity. It does not matter what kind of medical interventions they have had or have not had, or how they dress or present. If a veteran says they are a woman, they are a woman, and VA will address them accordingly. Their VA care right now can include many things, to include hormone therapy, mental health care, vocal coaching, prosthetic support, a lot of different interventions to support them in their transition, including preoperative evaluations, both medical and psychological, and medically necessary postoperative care. Currently, VA does not offer gender-affirming surgical procedures. However, there is a rule-making change in process to remove this exclusion of gender alterations in the medical benefits package. The take-home point here is that the use of veterans' preferred name and pronoun is required by all VA employees in their interactions directly with veterans, in conversations when the veteran's not around, and in documentation about the veteran. So that means that when a veteran needs to use a restroom, they use the restroom of their choice. When they are assigned a room for residential treatment, the room assignment is based on their gender identity and not their sex assigned at birth. And again, VA employees must create that welcoming environment for veterans. In addition to these policies, LGBTQ+ Health Program manages 2 national e-consult programs. The Transgender and Gender Diversity Consult is intended to support local clinical services and increase access to high-quality care for veterans, and to promote clinical competence for providers. With a veteran's consent, this interfacility e-consult will allow providers of any discipline to receive non-urgent consultation from a team of experts on transgender and gender diverse care. The topics can be about mental health assessment, hormone therapy, psychotherapy, primary care, prescribing medications. It's not limited at all. It's a provider-to-provider consultation, and so there's no direct care that's provided by the specialty team. They are located in Minneapolis and Tucson and serve as that very valuable second opinion and subject matter expertise about transgender care. The Gender Affirming Program for Speech, or the GAPS program, was established in 2021 to improve and standardize voice treatment programming that would utilize virtual care options to expand access to high-quality voice and communication treatment for rural transgender veterans. GAPS is trying to narrow the gap in access to care by having VA speech pathologists experienced in voice evaluation and treatment use telehealth technology to provide this care directly to veterans in their home. These services can be accessed through interfacility consultation from any VA provider. And the flyer here on the right provides more information about GAPS and how it can be accessed. This is on our public-facing website through the link on this page. And now I want to share some information about what I think is one of the most wonderful components of LGBTQ plus health programming, and that is our LGBTQ plus Veteran Care Coordination Program. This program originated in 2016, so it's relatively young in VA time. And the LGBTQ plus health program leaders realized that there was a critical need for every healthcare facility to have a designated point of contact because LGBTQ plus veterans are seen at every facility. And so care coordination was implemented to engage LGBTQ plus veterans in routine and preventative healthcare and prevent the healthcare experience and improve the healthcare experiences and health outcomes among LGBTQ plus veterans. These VCCs are boots on the ground problem solvers. They are ensuring culturally competent, patient-centered, effective care is delivered in an affirming environment. VA has responded to the growing awareness of the number of LGBTQ plus veterans by targeting programs to meet their unique health needs, and we continue to expand and increase those resources to meet the healthcare needs of this population of veterans. The LGBTQ plus Veteran Care Coordinator Program ensures that every facility has one point of contact, and that person reports to the Medical Center Director and works under the guidance of the National Program Office and their VISN lead. These positions are typically collateral duty assignments, but increasingly we see full-time positions being implemented within facilities that recognize the importance of this role and the need for more support and programming for the LGBTQ plus veterans they serve. There are currently more than 210 LGBTQ plus veteran care coordinators and 20 regional VISN leads across the nation. And so more specifically about what they do, they support the implementation of national policies. They make sure that culturally competent care is being delivered to LGBTQ plus veterans. They investigate and recommend corrective action when there's an issue at the facility and notify the medical center director in that process. They communicate with service lines like primary care and rehab and homeless to provide tailored guidance and education to staff as it's needed. They are the point person, the source of information, the veteran advocate and problem solver for everything within the facility for LGBTQ plus health. They identify the needs of LGBTQ plus veterans and assist the facility in developing the resources. They participate in strategic planning and activities with leadership to accomplish affirming care. They serve as a liaison to the community, and they outreach and participate in community outreach events. They also maintain communication about their program on the facility's website, and they communicate to the public via different resources and participate in community events. And so VCCs are incredibly busy trying to make sure that we are delivering the best healthcare possible to LGBTQ plus veterans. And this slide just gives you information about how to get in contact with your local LGBTQ plus VCC. VCCs are here to assist you by connecting you to resources in VA and in the community, by promoting a safe and welcoming environment, by developing ways to support LGBTQ plus veteran health, and providing education and training to your teams. You can find your local VCC at any VA healthcare facility or on their website, or you can email our program office to inquire. We are always happy to help you. And VA employees can access our Veteran Care Coordinator directory on SharePoint to locate a VCC. As I mentioned earlier, one way that we promote a welcoming environment for LGBTQ plus veterans is to use signs and symbols where veterans can see themselves or identify allies or safe spaces. Here you can see examples of some of the signage and resources from VHA's major LGBTQ plus awareness campaigns throughout the year. LGBTQ plus health awareness is in March. LGBTQ plus Pride Month is in June. LGBTQ plus History Month is in October, and Transgender Awareness Month and Day of Remembrance is in November. World Sexual Health Awareness Day on September 9th has also been added to VA's official OPIA calendar of observances. Many of the signs and symbols and posters here are publicly accessible to you, and they truly serve as signs of safety for LGBTQ plus veterans. Signs and symbols of recognition and visibility matter a great deal to a stigmatized population. And this next resource is a quick overview of the information that is publicly available. Here on our website, you can find your local VCC at any medical facility. You can review the frequently asked questions about our program. You can learn more about LGBTQ plus education and outreach. You can read or reference the full copies of the policies I just reviewed with you. You can take a training on LGBTQ plus resources. Continuing education is free if you link through VA Train. You can stay up to date on our special observations, including those downloadable resources I just mentioned, and you can subscribe to our listserv to receive email updates and our national program letter. And I just want to take a minute to talk a little bit about LGBTQ plus individuals and religion. It's often assumed that people who are LGBTQ plus have no interest in religion or in joining faith communities. That stereotyping perpetuates this misconception. In fact, many people who are LGBTQ plus enjoy a deep and abiding faith. Their longing for a loving and welcoming spiritual home is shared by all people of faith. In fact, religion is important to many LGBTQ plus people. According to a 2020 study completed by the Williams Institute using Gallup poll data, 5.3 million LGBTQ plus adults identify themselves as religious. Religious LGBTQ plus adults, including those who are moderately or highly religious, are socially, demographically diverse. They reside in every region and every state, and they're represented across religious denominations. Among them, LGBTQ plus adults, older adults, and Black adults, and those residing in the South are the most likely to be religious. In many parts of our country, it is still difficult to live openly as an LGBTQ plus person. In a 2014 study that was conducted by the Human Rights Campaign, LGBTQ plus folks cited preventing harassment and violence as their top concern, but they also talked about discrimination in the workplace and at their houses of worship. And as a result, many people of faith who are LGBTQ plus are unable to act on the impulse to worship and serve alongside others of like mind. Because our larger communities are closely linked to our congregations, people of faith play a critical role in ending violence and discrimination against LGBTQ plus individuals. The consequences of closing doors to LGBTQ plus communities can be devastating. Creating a safe and inclusive organization or congregation for people who are LGBTQ plus embodies the message that we're all one. Such communities create transformational and in many cases life-saving experiences. And so as you work to better understand the needs of the people, including veterans who are LGBTQ plus, the best course of action is often to simply just listen with an open mind and heart and an authentic desire to support the needs of LGBTQ plus people and their families. It will help you discern a path ahead and build programming and ministry that is rooted in unconditional love. You are in a unique position to support LGBTQ plus veterans. VA's faith-based neighborhood partners can provide support and show respect for LGBTQ plus veterans as fully whole spiritual beings. Your community can transform your belief in love and mercy and compassion into action. I encourage you to be bold in encouraging compassion for people who are LGBTQ plus as fully human and fully equal. foster a climate of compassion and respect that can help support increased resilience and healing related to previous ongoing religious trauma that have been experienced by many LGBTQ+ veterans. And remember that spiritual care should be framed so that a veteran does not ever see themselves as beyond the bounds of normal human struggle. I'd also like to share some ways that you as an individual can support LGBTQ+ veterans. You can do so by providing affirming care and support in a welcoming environment. You can practice respectful communication using the name and pronouns a veteran uses. Remember that words matter. The words veterans use for themselves matter. The words that VA uses about veterans matter. Completing trainings on LGBTQ+ health is something that you can do from our public-facing websites. You can also support veterans by attending and recognizing LGBTQ+ events and observances, and by wearing or having safety symbols visible, such as posters, pins, or lanyards. Signs and symbols are very important to a stigmatized population. And just remember that you're going to make mistakes while you're getting better acquainted with the LGBTQ+ community, and that's okay. Allyship is actually more about making mistakes than doing everything right. It's how you deal with those mistakes and move forward. Let people know from the start that you're open to guidance and feedback, and the more you open up, the easier it will be to learn and communicate effectively. If you mess up, try not to indulge in those negative feelings. Making mistakes doesn't make you a terrible person. It just means you've got some learning to do. And this slide is just a quick opportunity to think about what inclusive language would look like, because no one likes to be misgendered or misidentified or wrongly named or excluded. Gender inclusive language communicates the expectation of diversity and a welcomeness and a respect. So you can set an example. I'm Miss Brunson. Please call me Dana. My pronouns are she and her. What name should I use for you? Instead of using he or she, try they. Someone left their phone in here. I hope they come back for it. Instead of guys and ladies, and for those of us in the South and those with prior military service, sir and ma'am, try veterans or everyone. Good morning, veterans. It's nice to meet you, Veteran Smith. Instead of man or woman or person, try person, I'm sorry. Did you see a person in the red shirt just walk through the lobby? And now I want to share with you a brief video that was developed in June last month by VA employees from all over the nation who took time to record their thoughts on why pride is important in VA and serving LGBTQ+ veterans. Our Pride Counts at VA campaign is meant to inspire and educate and inform veterans that VA provides affirming, respectful care where veterans can feel comfortable talking about their sexual orientation and their gender identity with their providers, and most of all, being themselves.
My pronouns are she and they.
My pronouns are she, her, and hers.
My pronouns are he, him, his.
My pronouns are she and her.
My pronouns are she, they.
My pronouns are he, him.
My pronouns are she, her, they, them.
Pride means to me inclusiveness. It's important for my veterans to feel like they are included in everything that we do.
Pride is really about respecting all and making sure that everyone feels comfortable.
Pride counts at VA because all veterans deserve to get health care in a place where they can feel safe, where they can get the care they need, and most importantly, where they can be open and proud of who they are.
To me, it means providing a more welcoming environment, showing respect, dignity, also providing a sensitive and safe environment where veterans can come and receive their care.
Serving all veterans is important to me because I want them to feel safe and be able to be authentic at the VA.
Be open about your sexual orientation.
your gender identity, and your sexual practices. It is essential to achieving the optimal health and well-being at the VA.
Pride means to me service with love. Service with love is about repairing, connecting, and affirming our gender diverse veterans. It's about justice and care.
I want all LGBTQ plus veterans to know that you are loved, and it is such an honor and privilege to be able to serve you. I'm so thankful and grateful for all of the courage that you display whenever you share your truest self with our providers. VA Pride matters because healthcare equality matters. And I want you to know that this is your home. So welcome home.
All veterans deserve quality care, and I serve so that they can be free to be themselves.
I'm proud to serve them as a physician, as an ally, and as their advocate.
You matter. You are important. And it's my mission to serve you with dignity and respect.
Every day we're working as hard as we can to make VA a safe space for all people who serve, regardless of their sexual orientation or gender identity.
If you feel uncomfortable with your providers, sometimes they might give you a little hint that they're a safe and approachable person.
I am here for you, and VA is supportive of you.
And I want all LGBTQ plus veterans to know that they are safe and given excellent care.
You are welcome, you are cared for, and you belong.
We see you.
I see you. So, I'll see you all at the VA.
So thank you so much, Ms. Brunson, for that very informative presentation. What a wealth of information, so important to have. Now I know the difference between orientation and behavior. It really helped me a lot to better understand the LGBTQ community. We do not have any questions in the Q&A box at this time, but if you do have some questions for Ms. Brunson, please send them directly to her. As you look on the screen, you will see her website information where she can be reached. And if you can also reach her through our team here at the Center for Faith-Based and Neighborhood Partnership as well. And we will get the question to her and she will respond directly back to you. Everyone that joined the webinar today will get a copy of this webinar, this presentation, excuse me. And also she has your email addresses where she can directly respond back to you. At this time, I'm going to turn the mic back over to Mr. Washington for some closing remarks. Mr. Washington.
Thank you, True. I appreciate it, Dana. Great job. We really appreciate you sharing this information. The VA is in a unique place right now, as you know, with serving such a diverse group of veterans, families, and beneficiaries. And this is one group that has not received the recognition and that it deserves. And so we appreciate you being part of the VA team and doing what you do. And we want to have you back. So thank you very much. And I will share with the audience today that sometimes we find ourselves in situations where we need assistance. And so I wanted to amplify, you may have heard, I know you have, the Veterans Crisis Line. If you find yourself needing assistance for a specific crisis, you may call the Veteran Crisis Line at 1-800-273-8255 and press 1 if you're a veteran. I'll say it again, it's 1-800-273-8255. And that was effective as of last year. So please use that if you need it. And also you have the option to just merely dial 988. That's easy to remember. If you find yourself in a crisis, just dial 988. And also you can use the chat by text at 838-255. Again, that text is 838-255 or 988. And we appreciate each of you for joining us today. And again, we thank you for having us. We thank you for joining us and we appreciate you. And we wish you would come back and join us again soon. Take care.
Thank you so much. It's been a pleasure.
If you registered for this event, we will provide you with today's presentation. A recording of this webinar will be provided on our website at a later date. Please subscribe to our website and Facebook for future webinars and information. Thank you for joining us today and have a great day. Thank you. Bye-bye.